In California, for decades, the behavioral health system has been stagnant. The Mental Health Services Act passed 20 years ago to fund behavioral health. But the way we treat mental health and addiction today is not the same as it was back then. And the old way is no longer the right way. 3 years ago, our county began taking unprecedented steps to build a better behavioral health system locally. I am so proud of the progress that we have made. 37 mobile crisis response teams, 3 new crisis stabilization units, 77% increase in new behavioral health full-time employees. And we helped open and produce nearly 900 new shelter beds and safe parking spaces countywide. But as we've made these changes locally, it became clearer every day that changes are needed at the state to better support new modern ways of delivering mental health and addiction treatment. So thanks to Governor Gavin Newsom, the state, Senate, and the Assembly, we now have an opportunity to make sure local practices and state funding are aligned to better serve our community. Proposition 1, treatment, not tents, is a critical solution. Tomorrow, my colleagues will vote on a resolution that I am bringing forward to support this ballot measure in March to modernize the Mental Health Services Act. Prop 1 will allow us to get more people treated and on a path to a better quality of life. If passed by voters in March, Prop 1 will refocus billions of dollars in existing funds. Prop 1 will prioritize individuals that have the greatest mental health needs and are living in encampments or suffering from substance abuse challenges. Prop 1 will help build over 11,000 new treatment beds and supportive housing. Prop 1 will create 26,700 outpatient treatment slots. Prop 1 will set aside $1 billion for veteran housing. And Prop 1 will recruit and train 65,000 mental health workers. Given all the changes that we have made at the county since I was elected 3 years ago, we stand to benefit enormously if Prop 1 passes and the funding from the Mental Health Services Act is reprioritized. So this is why I'm asking my colleagues tomorrow to support my resolution supporting Proposition 1. It is now my honor to introduce Raul Campillo, council member of the City of San Diego. The county and the city work closely together on behavioral health and homelessness issues. And earlier this month, Raul, our next speaker, authored a resolution and secured votes from his colleagues at the city to support Prop 1. So with that, Raul Campillo, it's my pleasure to introduce you. Thank you.
Thank you very much, Vice Chair Lawson-Remer, and good morning. We are about to bolster San Diego's behavioral health system with Proposition 1. Mental health and addiction and homelessness are some of the most pressing issues facing San Diegans in all of California, and our family, our friends, and our neighbors during their times of need are being told that there is no place for them to get the treatment that they need, the very particular types of treatment they need as well. Our social workers, law enforcement, our nurses and outreach workers, and behavioral health workers in hospitals are having to tell them that they have to wait weeks or months, and sometimes even more than a year, to get the proper treatment for what ails them. Our lack of behavioral health resources is a downright tragedy, and it's plain and simple that we need to solve it right away. Our distressing status quo stems from decades of stigma and fear, unaccountability, and underinvestment. And I've seen this crisis play out right here as a San Diego City Council member, and I've demanded again and again that our entire region step up, and Vice Chair Lawson-Remer is stepping up with this resolution. In September, I called a special Economic Development and Intergovernmental Relations Committee meeting to examine these issues further, where we had members of the county and members of our hospital association, law enforcement, first responders tell us what needs to be done. I then led the City Council in declaring a behavioral health bed crisis and most recently introduced the city's resolution to support Proposition 1. That's why I'm glad that Vice Chair Lawson-Remer has brought this forward to the county for support as well. We can't solve such complicated issues like systemic underinvestment in mental health and addiction treatment by working independently. I'm proud to work side by side with her, and the only way we're going to solve this for our region is for the city and the county to work together, and for the state and federal government to amplify, not detract from each other's efforts in addressing this crisis. As Vice Chair Lawson-Remer said, Prop 1 helps the entire state of California make the investments we need to make a serious dent in this issue, in this behavioral health bed crisis. By reforming the Mental Health Services Act and creating a $6.4 billion bond to build 11,000 new behavioral health beds across the state, including what San Diego deserves, Prop 1 will help people going through the most terrible tragedies and most difficult times of their lives get the help they need. And in turn, Prop 1 has the potential to help lower hospital wait times, reduce the strain on our first responders and and law enforcement, and reduce homelessness. What's more, passing Prop 1 saves us money in the long term. I repeat that, saves us money in the long term by doing what we need to do. Give people the treatment when they need it instead of the far more expensive care that is only available to them now. When the city of San Diego declared its support for Prop 1 several weeks ago, we said loud and clear that as a city we're ready for serious movement on this behavioral health issue. Tomorrow the county has a chance to do the same, and I joined Vice Chair Lawson-Remer in calling on the County Board of Supervisors to pass this resolution to support Prop 1 because San Diego, both the city and our county, cannot afford to wait longer to make our behavioral health system better for those who need it most. Thank you very much, Vice Chair Lawson-Remer, for having me here today.
Thank you very much. Now it's my pleasure to introduce Christiana Paul. She's Vice President of the Continuum of Care at Sharp Mesa Vista Hospital. She has so much expertise and insight about the current challenges in behavioral health access and services, as well as potential benefits that will result from the passage of Prop 1. So that with that, please welcome Christiana Paul. Please join me at the podium.
Good morning, my name is Christiana Paul. As the Vice President of the Patient Care Continuum at Sharp Mesa Vista Hospital, the largest freestanding behavioral health hospital in California, and a licensed marriage and family therapist, I'm all too familiar with how the shortage of behavioral health services plays out for patients and their families. Nationwide, nearly 1/4 of adults with a mental illness do not receive the treatment they need. Many people end up turning to hospital systems to get behavioral health care. And in California, individuals with a behavioral health diagnosis account for 1 in every 3 hospital patients, and nearly 20% of emergency department visits are by someone needing behavioral health care. I want to thank Supervisor Lawson-Remer and the Board of Supervisors and Councilmember Kempkio for recognizing the behavioral health crisis in our region and for their commitment to solutions. This is a crisis. Unfortunately, it is not new or easily fixed. Post-acute behavioral health care is a vital component to the care continuum that provides ongoing support and recovery services to patients after their psychiatric crisis has stabilized. These services include residential, outpatient, and community-based programs that support patient needs and help prevent relapse and rehospitalization. Last year, across San Diego County, there were over 17,000 days of inpatient psychiatric care provided to individuals who no longer required hospitalization, but had to stay in the hospital because post-acute care was not available or accessible. These are patients who should have been discharged to either a higher or lower level of care, but because there is a lack of behavioral health services, our patients wait for months and even years for placement. This situation is unacceptable and unsustainable. It puts our patients at risk of worsening their mental health condition and reducing their quality of life and well-being. It also puts a strain on our emergency departments that serve our community. Often at Sharp Mesa Vista, over 10% of the adults have been in the hospital for over 2 months, waiting for a place to transition their care. Psychiatric hospitals like Sharp Mesa Vista are designed to stabilize an acute psychiatric crisis. They are not designed for long-term treatment. It is demoralizing for patients and staff when they can't be discharged to a setting that's most appropriate to meet their needs. One patient has been in our hospital well over a year, despite being #1 on waiting lists for over 6 months. Think about this. Can you imagine being hospitalized for a physical injury or illness, and then when you no longer need inpatient care, being required to stay in the hospital for months or a year because there was no place for you to go for continued treatment? This is exactly what's happening on a regular basis to many behavioral health patients, particularly those who are unhoused. The lack of step-down and outpatient behavioral health services mean patients are stuck in the hospital, unable to move forward with their recovery journey, and other patients in crisis are unable to access those behavioral health beds. Proposition 1 would make changes to the state's mental health system that could address some of these challenges. For example, the passage of Proposition 1 would allow Mental Health Services Act funds to be used to treat people with substance use disorders. As of this morning, there is a 6 to 8 week wait for a county residential treatment facility. The long waiting list for a bed in one of the region's 3 substance use disorder treatment facilities that accepts Medi-Cal is testament to the critical need to fund substance use disorder treatment. Proposition 1 also includes a general obligation bond, which, if approved, would be used to build new behavioral health housing and treatment facilities. The need for additional capacity for treatment facilities and services in San Diego County beyond the hospital has been documented by multiple studies, reports, and grand jury findings. While Proposition 1 may address some of the challenges impacting today's behavioral health crisis, it is important to remember that this measure will not be a quick fix or comprehensive solution. Continued efforts and investments will still be needed in San Diego County as we seek to improve the behavioral health continuum and end the crisis for the San Diego region. Thank you.
Thank you so much. It's now my pleasure to introduce Crystal Irving. She's a social worker as well as president of SEIU Local 221, our county workers. She comes with a really incredibly important perspective because social workers and behavioral health clinicians regularly come in contact with San Diegans who would benefit from more resources to assist with their mental health and substance use disorder challenges. And she's here to speak on Prop 1 and how it could benefit our county workers. Thank you, Crystal.
Thank you. And thank you so much for bringing forward this resolution to the county. Again, my name is Crystal Irving, and I'm proud to stand before you as president of SEIU Local 221, where we represent about 14,000 workers here in the region, and also a member of SEIU California, where we represent over 700,000 workers across the state. And it is my honor to stand here on behalf of those SEIU members and our families statewide to do what is right, and that is take care of the people who are suffering from mental health problems in our streets. SEIU members are on the front lines of California's mental health crisis. We are social workers, outreach workers, healthcare workers, housing workers, caregivers, teachers, park workers, and nurses, both in the detention facilities and the psychiatric hospital. And we are here on the front lines of this crisis. Each and every day, our dedicated county outreach workers show up to work determined to rebuild trust and deliver compassion to people who have suffered too much cruelty. Yet, more often than not, our workers find their hands tied by siloed systems and bureaucratic barriers in the way of bringing people who are hungry, sick, and experiencing trauma into safety. Meanwhile, our state's shameful lack of housing and inadequate tenant protections continue the cycle of pushing vulnerable people onto our streets. SEIU members also live in neighborhoods and communities where the state's failure to care for people in crisis is becoming more and more evident, and it's impacting us all. And for every Californian, the crisis of mental illnesses and addictions are deeply personal. We all know parents, siblings, children, cousins, or friends who have needed help and have had to wait weeks, months, or years to get the services they need. And like so many other public health crises, untreated mental illness and addiction do disproportionately harm communities of color. And as a union dedicated to racial justice, we know California must do better by our Black and brown population. In the meantime, living on the streets makes Californians already harmed by poverty and racism more likely to land in jail than in safe housing. Transforming care for people living with behavioral health challenges is the reason SEIU members wholeheartedly support Governor Newsom's Proposition 1 on the March ballot, and the reason we're here for the resolution here in the County of San Diego. No matter where we live or work, SEIU members know this. People in behavioral health crisis deserve treatment, not tents. People caught in a system of poverty and addiction, often compounded by systemic racism, deserve a chance at recovery, not incarceration. So we are asking Californians to join us in voting yes on Prop 1 this March to expand community mental health and addiction services and build the supportive housing needed to transform the lives of thousands of people on our streets. To also build the workforce we need to get people quality care more quickly and empower frontline workers to craft solutions based on their expertise and the time they have dedicated to providing these services. And SEIU members, we are proud to be on the front lines of this care. And that is why we urge all Californians to join us in voting yes on Prop 1. And we're urging all county supervisors to vote this resolution into effect. Thank you so much.
Thank you so much to all my colleagues for being here today and here to just really urge my colleagues on the Board of Supervisors to vote yes on this resolution I'm bringing forward tomorrow, because it is just so incredibly important that the people of California deserve treatment, not tents, when they're struggling with mental health and addiction issues. So thank you so much for being here.